All right, Natalie, John, you think we're ready to get started?
I do.
All right, well, welcome everyone. My name is Sarah Roof. I am the Communications Director at the Arizona Developmental Disabilities Planning Council. We are happy to be a part of the team at the Arizona Developmental Disability Network, bringing you today's session here on Zoom. We are excited to have some folks from the Arizona Department of Health Services to help share information about the COVID-19 vaccine here in Arizona and what that means for our disability community. We have a lot of participants on the call today, so we appreciate your patience. If you'd like to introduce yourself, please do so in the chat box. We want this to be an interactive presentation with you all. That being said, we do have some guidelines that we share at the beginning of each of our calls. So I am going to share those with you right now. First of all, we assume good faith uh, with your colleagues on the call today. We're all here to learn together. Please use the chat or the raise hand function if you wish to share, especially during our question and answer section of today's session. Participants are not able to unmute themselves, so if you would like to share verbally, you will be called on after virtually raising your hand. Please recognize and respect each other's feelings, um, backgrounds, and cultural differences during today's call. And we are also going to be taking questions. However, not all questions will be answered during this meeting. This is an ongoing situation, and no one has the answers right away. We also want to um, just remind everybody on the call to be judicious and efficient with your information and experiences because we do have so many people on the call. We are going to keep you at 30 seconds. Um, so um, sometimes it's just as courageous to listen as it is to share. So thank you so much for being willing to share. And if you do plan on sharing, please speak slowly. We have an English captioner and ASL interpreters joining us today. So, thank you so much. I'm going to turn things over to our first speaker from the Arizona Department of Health Services. I understand that Dana Goodlow, the chief from the immunizations office, is joining us first to offer information. So, Natalie and Dana, if you are ready, I will pass the torch on to you.
Good afternoon. This is Dana. Now, I don't know, Dr. Lewis, were you able to connect?
Do believe, I thought she was on here.
I believe I have connected,
You're
but
there.
it says
All
my
right.
name too, your name, not mine.
Right. All right. I believe, Natalie, do you have our slide deck or do we need to share that?
I do believe, Sarah, you have got the slideshow? No.
Okay. Flexibility is key.
Oh, hold on. It's coming. It's coming. Just a moment.
So as I load the slideshow, Dr. Lewis and Dana, would you like to just share a little bit about your role at the Health Services Department?
Dr. Karen, go right ahead.
I am the medical director for immunizations. My background is I'm a pediatric infectious disease physician. And after 15 years of clinical work, I joined Arizona Department of Health Services. Dana?
Good afternoon, and thank you for the opportunity to join you today. I'm the office chief with the immunization program with the Department of Health Services, and we're excited to be able to share some information with you today about COVID-19 vaccine and about the distribution of COVID-19 vaccine. So I think if we can get our slides deck up, we can get going. I might be able to share it from my side if that's easier.
Yeah, why don't we do that? If you can go down to the bottom and go to the share screen.
All right, I'm going to try. When I did it before, it took over the whole window and then I couldn't mute, but let's see what I can do. And if I go from the beginning.
There we go.
All right. So Dr. Karen, you're first. I don't know. I've covered myself up and I can't move this now. So there's my stuff. I will go on mute. Karen, you let me know when to advance, please.
Okay, this is wonderful that we can get through technologically. Anyway, next slide. The virus that causes the illness COVID-19 is called SARS coronavirus 2, and it has proteins that stick out from it. There's a diagram on the left and an electron microscope on the right, picture showing the virus using those little projections that grab onto a cell, and they're called spike proteins, and they allow the virus to get into cells to grow and cause destruction and move on to the next cell and do the same. Next slide. To understand how messenger RNA vaccines work, it's important to know how viruses infect cells. The little blue and red spiky item is supposed to represent the virus. It gets into the cell and it uses the cell's protein making capacity to make more viruses, because the RNA in the virus, the ribonucleic acid, the genetic material, tells the cell exactly how to make the proteins, how to make more RNA. The viruses assemble, they leave, and they go on to more cells and more destruction. Next slide. We have 5 vaccines so far that are in development, have been approved or close to being approved. Pfizer and Moderna are the ones that have had an emergency use authorization. They are the messenger RNA vaccines that go through the process that I described to you. There are 3 more vaccines that are hopefully will be approved in the fairly near future. Both Johnson Johnson and AstraZeneca use a common cold virus called adenovirus, and the genetic material that tells the cell to make spike protein is inserted into the virus. The virus is very, very weak. It gets into the cells. It tells the cells to make the spike protein, but it's such a weak virus, it can't get out of the cell. But that's still enough for the cell to make the spike proteins that then sit on the surface, and the immune system sees them and thinks, oh, here's a coronavirus, we'll make antibodies. Novavax is a little different, more like our standard vaccine, in that spike proteins are made and combined with another chemical that just makes the immune system respond more strongly to the spike proteins. Next slide. Normally, with most vaccines, you can often expect pain, swelling, or redness at where they give you the vaccine. Not always. Sometimes you don't even notice, but sometimes you can have some fever, some chills, headache, tiredness, muscle aches, joint aches. Most of the time that doesn't happen. Sometimes it does. It is the body seeing the foreign material and having the immune system respond to it. So these are expected side effects after vaccines. Next slide. COVID-19 vaccines cannot cause COVID-19 disease because it's not a live virus. So the vaccine given to somebody can't spread the, I put down spread the vaccine, sorry, spread the virus to others because it's not a live virus. Now, even though you're immunized, we don't yet know scientifically if immunization, although it protects you, whether it will protect you from getting the virus in your nose and mouth and being able to spread it to people, even though you're vaccinated. So that is why you are hearing, even after you get vaccines, you need to still wear masks and do social distancing. Next slide. Reasons to not get the vaccine is that if you have any severe reaction to a vaccine, or even if it's not as severe, if you have some type of mild allergic reaction to the vaccine or something in the vaccine, or if you've ever had problems with another vaccine, or let's say an injectable antibiotic, then if it just not super severe, sometimes a doctor can evaluate you and clear you to get the vaccine. But there are very few reasons not to get the vaccine besides what I've mentioned on this slide. Next slide. People who the Centers for Disease Control and Prevention has said pregnant women may consider getting the vaccine, that the benefit is felt to far outweigh any very small risk, and experts in obstetrics in the country have said that they do not feel, just by the biological aspect, that they see no risk to the pregnant woman. Breastfeeding's fine. If you have a weakened immune system, you may not respond as well to the vaccine, but it's not a live virus, so you can get the vaccine. People with autoimmune disease also can get it. This is such a pure, precise, tiny vaccine. It's not expected to worsen autoimmune disease. And other allergies are not a reason to avoid the vaccine. They're not what we call a contraindication. Next slide. And this is a final slide for me. You get about 50% protection after the first dose of an mRNA COVID vaccine. It takes about 2 weeks, but then even if you do come down with COVID after that first shot, it tends to be more mild. By a week or so after the second dose, you have 95% protection. That is excellent in terms of what vaccines can do. We don't know how long the protection will last. So it's still important to protect you and to protect others, as I mentioned, for you to wear a mask, wash your hands, and socially distance. Back to you, Dana.
Thank you, Dr. Karen. All right, so I will share some information with you about our plans in Arizona and how we distribute this vaccine while we have really limited supplies. So this first slide just gives a general sense of the process. The diagram on the right shows that the CDC will let us know in Arizona how many vaccine doses are available for us. We learn this weekly at this time. We then take that information and we share it with our local allocators, who are our 15 county health departments and 4 tribal entities that have chosen to receive their vaccine allocation through the state. Now, you may recall that here in Arizona, we have several tribal entities. Most of the tribal groups in Arizona have opted to receive their COVID-19 vaccine allocation through Indian Health Services directly. So again, the CDC will allocate to the state, and the state then passes these doses on to our 15 county health departments and tribal entities, and then they decide where in the community these vaccines will be distributed and be ready for use for vaccination. Part of the decision-making process includes 2 different advisory committees. One is the ACIP committee, which is the CDC's advisory committee on immunization practice. They make a determination of who they feel should be vaccinated, especially in the early stages when there's very little vaccine. Once ACIP has made their recommendation, that information comes back to the state, and Arizona's Vaccine Antiviral Protection Advisory Committee, or VAPAC, then looks at those recommendations, makes a determination of if they apply and are appropriate for the populations we have here in Arizona, and then we make our own recommendations and go from there. You'll also note in the diagram to the right that there are a couple of other opportunities for sharing vaccination with some of our, for specific projects with some of our partners. As you guys know, initial vaccine supplies are very, very limited. That is why it is so important to prioritize populations for vaccination. So phase 1A started mid-December and was primarily targeted at healthcare personnel and residents of long-term care facilities. In Arizona, we've been able to start vaccinating those groups mid-December. Our allocation continued, and we see new vaccines being delivered weekly. So we were able to move into the phase 1B prioritized group. And this is a really large group here in Arizona, and it includes a lot of different individuals. Initially, with our phase 1B group, we had 75-year-olds and older, law enforcement officials, and teachers. And this was a determination made by, again, the advisory committee and our governor, who really wanted to focus on being sure that we could get kids and teachers back into the classroom. So we moved our teachers into the upper part of our 1B prioritization. About a week ago, Health and Human Services, our federal partners, decided that it would probably be a good idea to include additional groups in 1B. So the advisory committee in Arizona posed a vote very quickly and determined that adding 65 and above was also appropriate for phase 1B. Unfortunately for all of us, we have not seen an increased allocation of vaccine to include this additional group. In Arizona, our 65 and up population is 750,000 people, and our allocation remains the same as it has been. Additional phase 1B priority populations will be added as more supplies become available. The ACIP recommendation included individuals who are younger than 65 with underlying health conditions. They will be included in phase 1B as well. They are just not included in most cases right now because our supply does not meet demand. And it's really hard to have everybody be the priority, especially when we don't have vaccines. So this particular slide gives you a little bit of an indicator of which phase our county partners are in at this time. And that, excuse me, because our supply is so limited, we have allowed that our county health departments can sub-prioritize within the individual phases. So you'll note in this slide, and this is available on our website and is updated daily, you'll see which phase the communities are in. In some cases, a county may have very few doses available to give and is choosing to only vaccinate folks that are 75 and older. In other cases, some are not even in phase 1B yet. And in still other cases, maybe they are seeing the entirety of phase 1B. So this is a good place to go and look to gather some information about which phase the individual county health departments are in across our state. This will change fairly regularly, and as more vaccine becomes available, that will help this to move into the next phases and include more individuals for vaccination. Just for awareness sake, we do have many administration sites across our state. This blue line to the right is a hyperlink that will take you straight to our immunization page for finding a place for vaccination. It's important to note that in phase 1A, we've had over 200 vaccination sites that have been operational. The Department of Health Services opted to partner with the CDC and Walgreens and CVS to provide vaccinations in long-term care facilities. And again, those are part of phase 1A. The skilled nursing facilities that are enrolled in the program started being vaccinated the week of December 27th. We are told that all skilled nursing facilities that are in this program have had their first doses administered. We've been able to allocate additional vaccines for this program so that the assisted living facilities are now starting to book out appointments as well. What's important to note about this partnership is that Walgreens or CVS has to go to each location 3 times for a first dose, a second dose, and then a cleanup. And it's thought that with the cleanup, if they have new residents coming in, they may need vaccination. So that's the 3rd visit. So in Arizona, we have over 2,000 long-term care facilities that have signed for the program. So you can imagine that this is going to take a little bit of time. But fear not, it is ongoing. Appointments continue to be made. And there will be vaccine available to vaccinate staff and residents in all of these enrolled programs. Additionally, we are onboarding providers that will be able to provide vaccination. We have over 760 individual providers that are ready to receive vaccine when our allocation increases and allows. Additionally, we will be partnering with the CDC and the retail pharmacy program, and this will allow over 800 pharmacies in our state to receive vaccine directly from the CDC to increase our reach for vaccination. So access to vaccination, and I think these bullets really are intended to answer some of the questions that we know you guys have. It, of course, is not going to be all inclusive, but it's some of the very common questions that we see. Vaccine is free of charge. There will be no charge to a person being vaccinated. It is possible that the person who is providing the vaccination may choose to charge an administration fee to your health insurance. But if you don't have health insurance, they cannot refuse you vaccination. In Arizona, we continue to add vaccinators. We have county health departments, county community health centers, pharmacies, and access health plans are actually engaging with us at this time to help us find ways to get vaccination to some of our harder to reach populations. So we're talking about folks that didn't sign up for the long-term care facility program, but group homes and developmental homes and those kinds of settings that have not signed up for the program will be covered for vaccination, either through a county health department or through a partnership with Access and the health plans. Those specific details are still being worked out at this time, but there's definitely activity and action coming as soon as we possibly can. Some folks are curious, how are you moving into phase 1B when you haven't finished vaccinating phase 1A? Part of that is because we have plans in place to cover the folks in 1A. The healthcare workers, we feel we have done a pretty good job of reaching them to this point. The folks in 1A don't ever lose their priority status. So as we continue to receive vaccine, individuals in 1A can still be vaccinated. And we're adding 1B because we have a little bit more vaccine available than we did before. Vaccination in nearly all cases is by appointment only. And again, this is because of the need for social distancing. It will be very rare that a person can just walk into a pharmacy or walk into a health department and receive a vaccination for COVID-19. That is very unlikely to happen. Just want to remind everybody that right now, vaccine supply is expected to remain constrained for at least a few more weeks, but more vaccine will be coming. We have a new administration, so we at the state are very, very eager to hear what that means for this program. We don't know if there's more vaccine readily available right now, if it means there will be a standing up and increased production of vaccine. We're just really interested in hearing more. What we do know for sure is that there will be vaccines for everybody that want them. It's just going to take us a little bit more time to get to that point. So with that, I will say thank you. I will stop sharing, and I think that we would be happy to take your questions if that is what would be appropriate at this time.
Thank you so much, Dr. Karen and Dana. Yes, we have a lot of questions. A lot of people submitted questions prior to the meeting as well. I see Jamie Edgen has her hand raised. So, John, can you give Jamie the floor?
Sure thing.
Hi, everyone. Thank you for those clear talks, Dr. Karen and Goodlow. I'm a scientist working with people with Down syndrome, and I just wanted to make everybody on the call aware that at the end of December, the CDC put Down syndrome on the high risk category. And I'm wondering how the Department of Health is communicating that within its committees and also to the different counties in terms of how they view their prioritization of individuals with Down syndrome.
Yes, thank you. That's a great question and comment. We are always receiving new information. It sometimes feels like things change by the day, but we are getting lists from the CDC of what they consider to be underlying conditions, and where they feel that they fit on the prioritized list. So we will bring those lists forward for our VAPAC advisory committee to look at those. But within the county health departments, just as they have the ability to kind of determine which phase they are in and have the ability to do some sub-prioritization, I think the underlying health conditions is another area that they may have to consider which conditions they can focus on at what time. Because it's a little bit further out than right this minute, those discussions are still happening. I don't know that there's any definitive answers just yet, but we're also working on putting some materials together to help inform decision-making at the county health departments and across the state.
Thank you so much. We have some folks on the phone. If you would like to raise your hand on the phone, make sure to press *9 and we will get to you. I've seen a lot of questions in the chat about those advisory committees that you referenced who are helping advise the state and the counties on their distribution plans. There are specific questions about whether or not any people with disabilities, developmental disabilities, to be clear, are serving on that committee, and if any caregivers of folks with developmental disabilities are serving on that committee.
I do not know who the participants are in the CDC's advisory committee. So Dr. Karen, do you have insight on the participants for ACIP?
They have community liaisons that are not part of the voting committee. But they have had vigorous discussions over many months about prioritization to do it, to balance the need to get the vaccine out to the people who need it the most. But I do not know that specific answer.
Right.
You know about the Arizona advisories? I'm sorry for interrupting.
Yeah,
About
the
statewide
VAPAC,
one?
the VAPAC committee, there's information on our website about the VAPAC committee specifically and who the participants are. We have a wide range of participants from county health departments to medical associations to health plans. And so I don't believe that we have any developmental disability individuals on the committee, but several of the groups that are there do represent, because that is their patient population. They are part of their patient population. But there's more information available on the website.
Great. We'll track that info down on the website and make sure to get that out to all the attendees. By the way, we will be collecting all the questions, both answered and unanswered, into a document and sending that out after this Zoom call. I'm going to ask one more question on behalf of the group, and then, John, if we could start going to the phone lines. Another question that folks have from the chat log concerns people who live in the community but have high medical needs, are at high risk, but they do not live in a licensed group home or another congregate care setting. A lot of people have questions about where, if people are classified by their residences, but they still are at high risk, where they fall in those county phase groups.
Yeah, that's another great question, and I don't know that I have a definitive answer on this just yet. It's definitely on the radar. There are folks that have the ability that that would be in a higher risk group that don't live in those homes but have the ability perhaps to travel, that could go to a pharmacy for vaccination. So that area. And some of the pharmacies we believe are going to focus on that particular group going forward. But this is especially where the access health plans come in, and the physicians in the health plans are talking about how best to travel. If we needed to go into a home to do vaccination, could we do that? And it's absolutely something that is being discussed currently. One of the things that really makes that challenging is that these vaccines are stored in such a way that it makes them really, really hard to transport. And so it might be better to wait a little while longer until we get a different type of vaccine, because the different type of vaccine is a single dose, it's refrigerated versus ultra low temperature. It doesn't need you to go back a second time. So those kinds of decisions and conversations are ongoing, but definitely on the radar for folks.
Thank you so much. All right, John, let's go take some live questions. I see lots of hands raised. Let's hear from Mohammed Abu Bayed.
All right. Mohammed, you should have gotten a prompt.
Yes, you hear me?
Yes.
Okay. So I have a son that has autism, and I'm the caretaker for him at home. Which category are folks with autism in?
Dr. Karen, are you aware? I don't know that autism by itself is considered an underlying condition.
The CDC has a list on its website of people who have been shown to have increased risk of complications, severe disease with COVID-19. And I have not seen them on that list. Granted, people who don't have underlying health problems can also get severe disease. That's why we all want to get the vaccine out as soon as possible to as many people as possible, and in the best prioritized way possible.
So it sounds like right now.
My
It
understanding.
sounds like right now, people with autism are just going to be general public.
General public. Yes, that's my understanding.
Thank you. Thank you.
Thank you so much. All right, we're going to go now to Jordan Moon. John, if Jordan Moon can be chosen now.
Sure thing.
Can you guys hear me?
Mhm.
Awesome. Thank you very much for coming to speak to us. My question is about the accessibility of making appointments. I know as a blind person, there's a little bit of quirks, especially with the Maricopa County website. And I heard from some of my friends and just colleagues that some of the other county websites are not accessible or make it really difficult for somebody who uses a screen reader to access and register for appointments and to even understand which appointments are available. So I guess my question for you is, are you working on anything to make it easier for people who are blind to make these appointments? And is there an alternative method of making appointments, like a phone number that we can call that would make it easier, especially for people with low tech skills?
The short answer is yes. We are looking at that. The vaccine management tool that we have been utilizing it's challenged. It's new, but it's definitely got its challenges. And so we're looking at that. We're also, as we are progressing here, trying to build that in to some of our points of dispensing, like the State Farm Stadium, so that there is some access. And I'm trying to answer your question and open up a slide deck at the same time, because there is a phone number and I'm trying to find it. Dr. Karen, do you have it right here?
Are you thinking about the 844?
Yes.
Yes. There is a phone number that You can get assistance in, you use, well, the general phone number is 844-542-8201. It has a very long wait time, unfortunately, in spite of everything we're doing to beef it up. We're working with the poison control and the 211 system. Most cases, they will help people get to, direct them to websites or to the counties for more information. They have a limited ability to help with registration itself, but they have told me that in certain cases, they have been able to help. And I would think with somebody who is blind, that may be a situation, but that's the number, 844-542-8201.
Thank you for putting that in the chat button. You're faster than me.
Thank you. Yes, that's a great question, Jordan. John, let's go now to Darlene Jones Lundergan. She has her hand raised.
All right, Darlene, if you're on the phone, *6 will unmute you.
I can't.
There you go. We can hear you.
You can hear me? Okay, I'm sorry. Hi, my name is Darlene Jones Lundergan, and I live in the Tucson area. I have an adult son on life support with 24-hour skilled nursing that comes in and out. Half the nurses that are getting vaccinated, half that refuse that are anti-maskers, but they are not allowed in my home without a mask on. I also volunteer and help 75 plus people try to get signed up right now for shots. Also, I found out today there's a private clinic in Saddlebrook, one subdivision that Andy Biggs is over, actually, down here in Tucson, that is giving vaccinations to only that subdivision, which is 55 plus golfers. That really concerns me, since my son on life support with nurses that aren't getting vaccinated are getting vaccinated. So I would like to know how the board picks and chooses people without looking at the fact of, we don't want ICU beds full. And if we don't want them full, why are we not choosing the people who will fill the ICU beds to get vaccinated first?
So Darlene, did you say saddlebags in Tucson?
Saddlebrook subdivision.
Well,
it's a
that
very wealthy subdivision that happens to support Andy Biggs.
Yeah.
And I'm sure he had something to do with getting those shots there, but I would like to know why that happened.
Yeah, I would too.
Because other people, even in their 80s here, can't get a vaccination.
Yep, absolutely. Thank you for bringing that to our attention. We will certainly look into this. But again, we go back to the allocation is kind of the way we have to operate right now. So we go through our county health departments, and then the county health departments look through their community and see who has the ability to provide this vaccination to the appropriate phase at that time. And so as for the most part, I know that in Pima, what is happening is Tucson Medical Center, Banner, the county health department. There's some other locations that I know have been doing vaccination out there. This particular site is new to me. I've not heard this at all. I can tell you vaccine is not being specifically allocated to that location. That would show up on our list. So if it is being shared, it's happening in a different way that's outside of what is expected and planned at the state level. So I am happy to pursue this just a little bit and figure out what's going on, because you're absolutely right. There's not enough vaccine to go around, and we want to be sure that we are vaccinating our prioritized groups and not necessarily others just because they would like it.
Great question.
Right.
Thank you so much, Darlene. We're going to go to our
Thank you.
next question from the chat box. Guillermo Gonzalez is asking how people can get vaccinated who do not have transportation to the large-scale vaccination sites. um, especially, considering if they are living at home,
Mhm.
maybe
Yep,
independently
yep,
with caregivers coming.
yep. This is another one that we are still working on. We have been in communication with Access. As you guys know, Access will, on occasion, I guess, pay for some transportation for medical appointments and those kinds of things. But we really don't want a high-risk person sitting in a car with a driver through a pod situation. That's just kind of exposing yourself unnecessarily. So there is some discussion about how we can kind of navigate that so that a person could be picked up, taken to the pod, and then perhaps a walkthrough situation, and then a socially distanced area post-vaccination, because we want everybody to sit for 15 minutes to be sure that everything's fine, which is standard with vaccination of adults. And then be able to be picked up and taken back to your residence. So there's definitely discussions about that right now. And Access is very, very interested in getting that pulled together.
All right, thank you so much. We're going to go now to Margarita Gonzalez with her hand raised. John, can you choose Margarita?
Go ahead, Margarita.
Okay, can you hear me now?
Mhm.
Hi, good afternoon. Thank you so much for the lovely information and precise information, not only lovely. My question goes as to what response immunologically are you expecting after the first dose? Is this going to be like an IgG very general? And then for the second one, would you be more specific as to one of the IgGs or IgAs being enhanced as for you to have the protection, or no studies have been done on that? Thank you.
This is Karen Lewis. I'll take that. The immune response to these vaccines are being studied very carefully. They are looking at IgG responses. They are also looking at cellular responses. They know from past experience that sometimes the cell-mediated immune system responds, normally it responds very positively, but sometimes it could have some negative responses that does not help against the illness. And so that has been included in the studies to make sure the vaccine is as safe as possible. So they are looking at T helper cells, and they're looking to see if they are type 1 biased, which is good in fighting infection, or if they're type 2 biased, which tends to be more allergic reaction, which is not a good response for vaccines.
Right.
Is that detailed enough?
Yes, thank you.
Good.
Great, thank you. We're going to go now to Becky Johnson with her hand raised.
All right, Becky, you should have gotten a prompt.
Yes, can you hear me?
Yes, go ahead. Thank you.
Okay, thank you so much. I want to ask, is Access working with other transit providers in the Valley to create some kind of a transit plan?
I do not have that answer. I know that they were just talking in general, but I'm not familiar with how it works, and I'm not able to answer that question. But if you guys included in a list of questions that you send to us after this call, we'll be sure to get more information about that for you.
Okay, thank you.
Certainly.
Someone in the chat did mention, Becky, this is from Stephen Leibsenberger. He says, oh, make sure to please mute your mics. Thanks, everybody. Yes, Stephen in the chat says, although Access technically pays for services, the contracted health plans coordinate transportation. That may be something you may want to look into, Becky. It's definitely a good question. Let's now go to Kara Carlson with her hand raised.
There you go, Kara.
Thank you. I have two quick questions. The first one I think is really brief. Is new supply from the federal government based on how much of the allocated supply has already been used? I've heard that some places, and so I just wanted a confirmation if we know that's true or not.
That is not true at this time. Our allocation is based on a pro rata, based on our 18 and above population, 18 years old and greater. Health and Human Services person last week said that it was going to be based on reported information. As of this morning, that is not accurate.
Okay.
It's still based on allocation, on population.
And then my second question is, we know that developmental disabilities, or at least we've known, there's been data coming out since about June that people with developmental disabilities, autism, I know Down syndrome was mentioned once already, and intellectual disabilities tend to have more severe adverse outcomes, up to 3 times more likely to die, 10 times with the Down syndrome. And I believe that at least the state portal already requires you to put your access number in if you're trying to make a reservation. And so I was wondering if there's been any push to try to make our DDD members eligible for the vaccine that way, to prioritize them since they are more at risk. I know that the CDC doesn't necessarily have every single individual disease. There's hundreds of people on this call, and I'm sure that each of their loved ones have a different cascade of diseases and issues and syndromes that they're dealing with. I think that they would all fall under the multiple existing conditions, or likely to fall under the multiple existing conditions. And I'm really interested in that. I've been trying to get some feedback on that. I know that the Arizona Center for Disability Law has been working on that. I've been working on that at momvacit.net. I just think that that's an easy solution, an easy fix, is to use the access number as a way to prioritize our DDD patients and get them in. Has that been
I have not heard of any efforts towards that at this time. But I would love to see an email from you that I could share with our leadership and see if it would be a thing that our vaccine advisory committee would be interested in helping us. Because one of the questions we get all the time is, what does underlying mean? Who is that? Which syndromes have to be included and which aren't? So it might be a much easier way to solve this problem. So I'd love to see an email from you if you don't mind.
Okay, Dana, and you can definitely, or Dr. Goodlow, I'm sorry, you can definitely count on that. I am on the Developmental Disability Advisory Council, and I will certainly follow up with you on that because.
And Dana is fine. I am not a doctor.
Oh, I thought you were. So no. I know Dr. Karen, and someone else, there was the Dr. Goodlow. So I'm sorry, but yeah.
That's totally fine. I don't mind the promotion.
If someone can get me, how should I find out your email address?
I'll put it in the chat box for you.
Thank you. That's it.
All right, great question. Still rolling through the chat. I am seeing people ask questions and then also people offering question or answering questions. So if you see a question in the chat that you know the answer to, please feel free to hop on and offer that. Just a reminder, and to myself as well, we do have interpreters and captioners on the call, so please speak slowly as much as possible. Iris Shiro in the chat box asks, are direct care workers, such as community and family caregivers, considered essential workers? And what kind of identification or documentation is required?
Right. At this given time, each individual needs to be qualified in the category that is being vaccinated at the time. So if the caregiver is not considered 75 or above, depending on where you're going to be vaccinated, 65 and above would count. If you're not a teacher, if you're not a frontline worker or a healthcare professional, then you would not be included at this time. Each individual qualifies by themselves.
Just a clarification, I think when it comes to uh, home health workers and professionals, uh, sometimes healthcare professional is used to talk about hospital and clinic type workers instead of home health. I think there's a lot of gray area that the community is struggling with. Does that
Mhm.
mean they should consider themselves healthcare professionals? I mean, I know us here at the council would consider them healthcare professionals,
Right.
absolutely.
I think that the short answer is probably no, because what they're thinking of is level of risk. And so you're exactly right. When you think healthcare professionals, they're thinking more hospital and clinic because of the ongoing exposures to multiple people all day, every day. And home care, I think, is considered less exposure at the time. I'm watching your face, Sarah. I'm sorry. That is the perception at the moment. I'm not saying it's right or wrong. I'm just saying that is how the decision was made with healthcare personnel. It was really more those that are in a large healthcare system that are having regular exposures.
Now, at least two people in the chat have indicated their employers, home health agencies have put them in 1A. So it seems
It's definitely not black and white. Yep.
right. Okay, great questions coming through. Let's go to somebody now who has their hand raised. Okay, this person doesn't have a name. This is 623-764.
All right, they should have received a prompt. If you're on the phone, *6 will unmute you.
Yes, my name is Mike White, and I have a son that has cerebral palsy and is a transplant patient, which is immunosuppressed. And I've heard nothing about transplantation patients and the efficacy of this vaccine, and then secondly, in what phase are these patients located?
This is Karen Lewis. Immunosuppressed people may not respond quite as well to the vaccine, but for the mRNA vaccine, they may still receive it because it can still be helpful. With some of the other vaccines that are coming up, if they're a weakened virus, we'll have to wait and see what the Food and Drug Administration says. Someone who is a transplant has an organ transplant or bone marrow transplant would be an individual with underlying health conditions. And at the present time, I believe they are in 1C. Still prioritized, but the 65-year-old and above, well, the 75-year-old and above have higher priority than the just adults with underlying health conditions.
So are you saying that those with transplant, that because it's not well documented the efficacy of the vaccine, that they should potentially wait for other vaccines to come out that may be a little bit more effective? So I guess the question is so what is a person that has a kidney transplant supposed to do? Are they supposed to go ahead and take a lesser, or is it advisable to wait?
Not right now, are the mRNA vaccines.
Yeah, I mean, I heard someone say there's not a lot of vaccine out there. If I remember right, people with underlying health conditions are in 1C. Currently, we're working through the 1B. I would get a vaccine as soon as possible if you do have immunosuppression. The mRNA vaccines should be very safe for people with immunosuppression. They just may not work as well because the immune system is, a little weakened, so there's not rejection.
Okay,
With
like the Pfizer then, correct?
yes, the Pfizer and the Moderna, they should be very safe. Whether they get 95% protection, I don't know. With the Johnson & Johnson and AstraZeneca, they're a very, very weakened form of virus. But it's a virus that can still replicate in individual cells. We do not yet have the emergency use authorization from the Food and Drug Administration, so I do not know if they're going to say, stay away from those vaccines if you're immunosuppressed until we get more information. The Novavax should be very safe, but right now I don't know the efficacy of the Novavax, but I know with Moderna, with Pfizer, 2 doses are 95% effective.
Okay, thank you very much.
Sure.
Great question, Mike. I did want to ask you all this question from the chat much earlier. There's some talk, and I'd like you all to address it about people of color and folks with higher melanin and how melanin interacts with the vaccine. Would you like to address that?
It is not the melanin itself that interacts with the vaccine in any way, but we know that people are of color, minorities, may have living situations where they do not have as much income, may not have as much access to health care, and just statistically have been at higher risk for serious illness with COVID-19. So that is one of the things that CDC has taken into account in its deliberations of trying to get vaccines out to people, healthcare workers, essential workers, people that can't work from home, which minorities tend to have in a higher percentage of minorities have jobs where they can't work from home. And so the recommendations of 1B and 1C have included considerations of trying to get people of color immunized as quickly as possible. But it's not the melanin itself.
All right, thank you for answering that question. We have time for a couple more. Kathy LaSouza has been raising her hand for a while. So, John, please give Kathy the floor.
Hi, can you guys hear me okay?
Sure can.
Hi, my name is Kathy. I'm disabled from mental health diagnoses, including PTSD, and I'm the 24/7 caregiver for my boyfriend who had a brain injury. My question is, while we're focusing on vaccines and he and I are waiting for our turn, is the health department addressing the potential discrimination against the disabled in the Arizona crisis standards of care? Should we reach a shortage of care or supplies that we're close to being in our hospitals regarding triage and prioritization? There are states that have updated and revised their crisis standards of care, such as Utah and others. for this very reason, to ensure that the premise of disabled people having a shorter life expectancy, for example, would be lower on the priority list than a non-disabled person.
Yeah, thank you for that question. I am in immunizations, and so that particular piece in crisis standards of care and hospital pieces, and that is not a thing that I really insight to. But again, I do know that our emergency operations center has been actively looking at the crisis standards of care and what's going on in our communities. So my best guess would be yes, but I don't know that for sure. So again, let's make sure that's on our list for follow-up questions, and we'll get more information back to the group.
Great.
We actually do have, oh, I just wanted to let you know, Kathy, Cy In is an attorney from the Arizona Center for Disability Law, and actually might have some information on that topic for you. Cy, are you
Yeah.
still on the call?
He was just when I talked to him last. I do believe. Here, I'm on you. Sai, if you want to say a few words.
Hi, yeah, can you guys hear me?
Yes, sir.
So I understand our law firm, along with other disability rights organizations, have reached out to Dr. Christ around concerning the crisis of care and the standards of crisis of care. There was some guidance initially back in, I believe, November, when this issue was going on. I don't know if the state has or the Department of Health has issued any new guidance, but ACDL, our law firm, would be really interested in having communications with ADHS and any other organization who would like to revisit this.
Yeah, my understanding was that local advocacy, disability advocacy organizations, including yours and others, over the summer outreached to the governor and to Dr. Chris, as well as along with the national disability advocacy organizations, to reach out to Health and Human Services. And my understanding is that, at least as of up until 2 weeks ago, from the summer, there's been no movement or adjustment to the crisis standards of care. And my husband, I was told by 2 neurologists that he wouldn't make it and be taken to hospice. So I know from firsthand, the catastrophe that could have been him no longer being with us, from the assumption or the presumption that a disabled person, or based on what was going on with him at the time, won't have any life expectancy or shorter life expectancy. My understanding is that this is not being corrected in Arizona, and I really hope we never reach a shortage. And it's great that we have vaccines, and it's great, as we continue with masking and all of that. But whether or not we have a shortage or we have herd immunity or whatever, we really, in Arizona, I don't think want to, especially on this phone call, I'm preaching to the choir, don't want to have anyone in the disabled community be exposed to discrimination because of policies that are on the book.
Sure, and I definitely agree with you. We don't want to get to that point, and we don't want individuals with disabilities to be triaged, to be considered to have a lesser quality of life. And ACDL is actively monitoring this. I apologize, I'm not the attorney who wrote the original letter, so I don't have personal knowledge, but I do know the attorney who has worked on it does have personal knowledge, and he has been following it. So I can follow up with him, and then I can reach out to you and the group once I have more information.
Thank you so much, Cy. We have time for one more question. And that is going to be Mark Stein has his hand raised. John, if you can give Mark the floor.
Sure thing.
Yes, hello. I was wondering, do you know when the COVID-19 vaccine will be available at pharmacies anytime soon?
Actually, there are some pharmacies in our state that already have COVID-19 vaccine, but their appointments are booked up for the next several weeks. So initially, you're going to be able to see this vaccine in Fry's and Safeway stores, or Kroger or Smith's or Albertsons, because company names. Those should start to appear in the next week or so, couple weeks. So keep checking their website, because they will have you sign up for vaccination through their own websites. So check that. But there should be in the neighborhood of 50 pharmacies in the state that will have it in the next couple of weeks. But ultimately, as we progress and vaccine becomes more available, we'll have over 800 pharmacies that will have vaccine.
Thank you.
You bet.
All right, everybody. I know we did not get to everyone's question, but let me tell you what we are going to provide after this call. We will be sending out a recording of today's session. We'll also include the chat log and the questions and answers. We'll also work hard to provide answers to the questions that we weren't able to discuss, and that will all be sent out via email. We also have some opportunities that you may be interested in, and Erica McFadden is going to talk about that now. Erica, are you ready?
Right, Erica, you should get a.
Thank you. I was on mute. Hello, everyone. I am the director of the DD Planning Council, and we saw your comments through the chat. We want you to know you are asking who is going to be doing advocacy for our people to be considered in prioritization for the DD community and their caregivers. And the answer to you is we all are. So what we're planning on doing is we're going to start drafting letters to send out to all the local health departments across the state, bringing up the issues that you raised today, as well as issues around the higher rates, of fatality rates among people with Down syndrome, especially those of advanced ages, including Down syndrome and people with intellectual and developmental disabilities. We believe the case can be made that underlying health conditions can include our community. And I think that we can make that case. What we're going to do is we're going to draft this letter. And if you all are interested, you also will be getting, as long as we have your email, which I think we do from the registration today, we'll be sending it out and you will be welcome to sign on. We believe that it takes a community to make these changes happen. I do not believe any of our members were reflected on the statewide committee that made the decisions, but we can make change to happen. It's happened in other states where families and individuals have advocated and they've changed it in real time. So we're going to be doing that. And I think, and we're going to be talking afterwards with the team, but it sounds like we're going to need a follow-up discussion with this group on COVID Part 2, because there was so much discussion and so many questions. So just stay tuned. You might be getting another meeting announcement in a few weeks from now with any other updates, because we're going to be sending those questions to the health department. They're going to come back and come with their answers, and then we'll be relaying that to you as well. I think that is all I have. I just wanted you to know, yes, we are going to be advocating. No, this is not. We know that there needs to be more happening.
Thank you, Erica. I wanted to include one more resource that we'll be sending out. I saw in the chat a request for a 1-page or 2-page resource in plain language with questions and answers for Arizona residents about the vaccine. That is being finalized today and it's ready to go. We will include that in the email. Please share far and wide. All right, I'm going to give the floor over to you, Jeff.
Thanks, Sarah. I'm just going to wrap it up here and say on behalf of the Arizona Developmental Disabilities Network, we appreciate Dana Goodlow and Dr. Karen Wilson for spending time with us today to answer so many questions. And we also want to thank everybody on this call for providing those questions as well. There are so many questions that we all want answers to. And just like when this COVID-19 pandemic happened almost a year ago, the ADDN network will continue to monitor and hold future sessions. So thank you all.
Thank you, everybody.